Dr. Randy Hudson, an anesthesiologist and critical care specialist, currently works as teaching faculty for the Masters of Science in Anesthesia at the UMKC School of Medicine and for physician and health volunteers overseas. He was director of the cardiovascular ICU at St. Luke's Hospital from 2000 to 2013 and twice stepped up to serve as chair of the Department of Anesthesia. Dr. Hudson calls his experience as a teaching physician one of the most rewarding aspects of his life.
My name is Randy Hudson. I have been a physician in Kansas City for 30 years and was on the staff at St. Luke's Hospital in the anesthesia department and critical care. What is my motto in life? Well, I think different is really what has made me coalesce my thoughts and make me be the different kind of physician that I am. Mentorship is important because it's how we teach and convey the professionalism and persona of being a physician. And so teaching and mentorship are not all planned activities, but I always enjoyed the students. I loved the interaction of teaching. I always found it remarkable how many different ways there were to think about issues and problems. And that was a very big positive for me.
Randy came to St. Luke's, came to Kansas City with his wife Duran in 1985. Duran was hired by Hallmark, and Randy was a tag-along spouse and joined our CV anesthesia group at that time. Randy volunteered at medical clinic for the indigent. He's lectured abroad at medical schools, and he's still active in training program at UMKC for anesthesia assistants. Randy found joy in his work and was compelled to give back whenever he could, and it's an honor to speak to his accomplishments, as I said earlier, both as a colleague, but more importantly, as one of my best friends for over 30 years. Thank you, and Randy, congratulations.
I've modeled a lot of the way that I teach in our unit based on how Dr. Hudson taught me. He took an interest in the people who really wanted to learn and really wanted to make themselves better. If you worked hard and expressed that and showed him, he would take you under his wing and he would teach and teach and teach. After my month in that unit, that's what inspired me to pursue critical care. You know, he did so much in leadership. I mean, in leadership for what he did to create our ICU, in addition to his leadership with the anesthesia department as a whole. I'm just struck at what he was able to accomplish. Our cardiovascular ICU, I think, provides a tremendous service to patients. And he really was the father of that unit. He is the one who had the vision and created the model, and most importantly, he's the one who convinced everyone to buy into that concept.
Well, let me first say that it's not the same. Randy was such an important part of our daily lives at St. Luke's that coming to work in the morning and not finding him in the pre-op area or the ICU, it's just not the same. The critical care concept really brought a growing amount of information to bear to help with the care of our patients in that immediate critical post-intensive care or post-operative in the intensive care situation. So Randy had a dream, and that was critical care. We had a dream to support that concept, and over the 90s, Randy grew a program that today is amazing. Randy is an amazing photographer. He may be a mentor to some in critical care. He's a mentor to me in photography. We had a chance to share a couple trips, one of which we went to Santa Fe, New Mexico, to participate in the Santa Fe workshops.
Well, I think Medicine is evolving rapidly. I would be remiss if I didn't talk about the issue of encouraging physicians to be involved, to look at where the future of medicine is going. We can't afford to leave this to the lawmakers and think tanks and our attorney friends. Physicians need to lead this movement into the future. From the last election that we had, we know that healthcare is a massive issue for people, and physicians can lead this change.
Congratulations, Dr. Hudson.